we would like to invite Professor Liu Xiaotong. He's presenting the COVID-19 and public health in China. So he's a Dean of School of Public Health and Management from Wenzhou University, Wenzhou Medical University. So passing to you, Professor Liu Xiaotong.
Hello, everyone. Firstly, thank you for the chairman. And I'm very honored to have the chance to share my presentation here together with all of you. The reason why I chose the topic, public health in China, just because of the COVID-19 pandemic. You know that the COVID-19 pandemic started by the end of 2019, and it has been lasting up to date. Well, if we take the prevention and control of COVID-19 pandemic as a test, Chinese government really did a good job. We have provided satisfactory solution for all over the world. So as a consequence, all over the world, the eyes has been attracted to China. So I'd like to give a brief introduction about public health in China today. It's just a brief introduction because of the limitation of time. So firstly, this is my resume. I once worked in University of Manitoba as a post fellow, and then Harvard School of Public Health as postdoc fellow, and then Columbia University as a visiting scientist. Right now, I'm just a professor in the School of Public Health and Management, Wenzhou Medical University. So in my presentation, 4 parts are included. Part 1, public health in China. Part 2, public health and health China policy. Part 3, emergency preparedness and responsiveness. And part 4, COVID-19 experience and enlightenment. So let's take a look at part 1. What is public health? What's the concept? We can understand it from both narrow sense and broad sense. I don't know how, actually in China, we have a different system, a little bit different from Western country, because in China, preventive medicine and public health are annexed as one discipline. Well, you know, in Western country, normally who is dealing with preventive medicine? Normally physician and nurses. But in China, preventive medicine belongs to public health. So from narrow sense, public health, we can understand it just public health equals to the preventive medicine. It refers to the prevention and control of diseases based on the biology, epidemiology, and behavioristics. For example, if we take infectious disease as an example, how to control the infection sources, how to cut off the transmission route, how to protect suspect populations is what we need to do. So besides infectious disease, we have to think about the risk factors of chronic non-infectious disease. So this is we can understand the public health from narrow sense. On the other hand, we can also understand public health from broad sense. That means preventive medicine, just one part of public health. Besides, although they have the same, purpose or destination, aiming at promoting the health of the entire population, but we have at this moment we have to add sociology and health equity, health policy, and so on and so forth. So this is the broad sense of public health. So this slide just shows the discipline of public health, epidemiology and health statistics, environmental and occupational health, nutrition and food safety, toxicity, toxicology, population health science, and social medicine. So let's take epidemiology as an example. We can understand epidemiology as a methodology, because when you want to know what's the current status of a certain region, how about their average lifespan, what's the disease profile, and how about their risk factor of chronic disease, and so on. Firstly, we have to design a scientific research to get the data, either investigation or survey. So right now we can use just cross-sectional study and give a description of the current health status. Then if we want to figure out the association between risk factors and disease, for example, smoking and lung cancer, we can design in different ways. For example, we can design a case control study. That means we just divided the population into two groups, lung cancer and healthy. And then we look back to see how many people in each group they are smoking, what's the proportion, and then we get the relationship between the smoking and lung cancer. So that is case control study. On the other hand, we can also design cohort study. So at this time, we just divided the population into two groups: exposure, non-exposure. That means smoking group and non-smoking group. And after a number of years of follow-up, we can find how many people in each group suffer from lung cancer. So it's just a brief example of epidemiology. Actually, it's very complicated. So just I'll take it as an example. So this slide just shows the discipline. Public health include all of this sub-discipline. So this slide shows the public health functions. Altogether, there are 11 functions. Firstly, the first one, monitor, evaluate, and analyze the health status of population. So just as I said before, when we want to describe the current status of health, we have to know the data. We have designed a kind of investigation or survey, and then described the health status. So this is the first function. After that, if we find something special, for example, lung cancer, breast cancer, and some other cancers are at top 5 cancer profile. But if we find thyroid cancer, then the top 1, we want to know what's the reason. What's the risk factor? So the second function, we have to do some research to find what's the risk factor of thyroid cancer. This is the second function. For third one, only physician and scientists know the risk factor. It's not enough. It's not enough. We have to let all the population know. So that is health education and health promotion. So that's the third function. And then we have to enroll all the public to participate in the prevention and control and how to deal with the risk factor so that induce the mobility and mortality of cancer or any other chronic diseases. So altogether, there are 11 functions. We can take a look at the last one. The last one refers to the emergency, public health emergency. We'll discuss it later on. So this slide shows the 8 categories of public health. I hope everyone can remember this slide, because later on we will introduce public health emergency. It's accordingly almost the same. So the public health include the control of infectious disease, food safety, tobacco control, the availability of drugs and vaccines, environmental health, health education and promotion, food guarantee and nutrition, and health service. On April 6, 2009, the State Council of China just launched an opinion on the new healthcare reform. In this document, the public health agency or institutions defined included as follows. The first, health administrative agency. The second, Center for Disease Prevention and Control, that is CDC. And then Health Supervision Agency, Maternal and Child Health Agency, Chronic Disease Prevention and Control Agency, Community Health Service Institutions, Public Health Research Institutions, and so on. From the history of public health, we can find that the concept of the contents of health has been upgrading all along. From the very beginning, maybe ever since the year of 1949, the new China established from the very beginning. So the government lay emphasis on the prevention of infectious disease, chronic disease. So that's the prevention concept. For example, food and drinking water safety, vaccination and prevention of infectious disease. And then let's take a look at version 2. At this moment, health policy has promotion and education, has equity, has been added. So the public health concept just turned broader and added the service into the new concept. Then the health goes to the version 3. Community health service. So as we all know that China has a huge population. It's about 1.4 billion population. So we have to lay emphasis on the community. Community staffs really did good job, at this time in dealing with the COVID-19 pandemic. So let's go to the part 2. Health China policy. We all know that the modern world, we can take it as an Earth village. So we have one Earth. But in Health China policy, the government just put forward a new concept, one health. When we made any documents, made any policy, health policy, we have to take health into consideration. And the final purpose is to improve or promote the health status of the whole population. So that's the main purpose. And we also enroll every people, all the public, to participate in this, in this campaign and share all the outcomes for health. So altogether, we will take three steps, and give up 3 time points: 2020, 2035, and 2050. The last time point is in the middle of this century, 2050. Why? Because we all know that not the year of 2050 is 100th anniversary of the new China establishment. So at that moment, we wanted to improve the public health, even to get a high quality of health, even higher than developed country. So that's the key and the final purpose of Health China policy. So many efforts has been made in Health China policies. For example, optimize health service, strengthen the public health service, and provide high quality and efficient medical service, give full play to the unique advantage of traditional Chinese medicine, strengthen health service for key groups, and also improve drug supply security system, improve the medical security system, build a healthy environment, and develop health industry. So just skip it because of the limitation of time. And then we'll go to the part 3, emergency preparedness and responsiveness. Let's go back to this slide. Public health has 11 functions. The last function referred to the emergency, public health emergency. So what is the public health emergency? It refers to the sudden occurrence of major infectious disease, mass cause unclear diseases, major food and occupational poisoning, and other events seriously affecting public. And emergency of public health are characterized by the following characters: all of a sudden, unexpected and unpredictable, but its occurrence and outcome also have certain regulatory uncertainty. It's difficult to predict the development possibility in the early age, and it's difficult to predict the possible dangerous states in the late stage. The third, public hazard. Public health emergency, it may cause varying degrees of harm to the public health, life safety, social and economic development. Derivative. Public health emergencies are often secondary, derivative, and infectious. Public attribute. The target does not refer to specific social groups, which has a wide range of influence. So this slide shows the category of public health emergency. We have referred it before. This category is just accordingly have something in common with the category of public health. So we can take a look at it. The first is epidemic of infectious disease. The second, food poisoning. And then occupational poisoning, pesticide poisoning, radiological hazard incidents, hospital-acquired infection, heat stroke in high temperature, and so on and so forth. Then, how to judge if the public health emergency is severe or not? What kind of degree? Actually, we clarified the public health emergency into 4 different degrees: general accident, serious accident, major accident, special major accident. Let's give some example. The left column show the categories such as infectious disease, food poisoning, occupational, or chemical poisoning. And the right column shows the different degree, such as general accident, major accident, special major accident. Let's take cholera as an example. Here, the first line. If it's just sporadic, or just we can find some carrier, it belongs to general accident. If the person of the patients are more than 5, we can define it as major accident. If there is massive outbreaks, we can define it as special major accident. For food poisoning, if the onset person are more than 20, we can define it as general accident. If the people more than 30, we can define it as a major. And then if the population, the cluster of population more than 100, we can define it as special major accident. Then this slide shows the nuclear and radiation accident. The severe or the degree of nuclear and radiation accident, just it all depends on 3 aspects. The class of radioactive source, how many people suffer from the accident, and what about the cumulative dose? If the people are just exposed to the class 4, class 5 radioactive source, it belongs to general accident. If the population exposed to class 3 radioactive source, it belongs to serious accident. And if the population exposed to class 1 and class 2, it can be defined as a major accident or special major accident, just because how many people suffer from the accident and what about a cumulative dose. So this slide shows the management of public health emergency. Actually, in China, we can describe it as just 1+3. 1 refers to the contingent plan. The 3 means in China we have 3 systems, including laws, institutions, and mechanisms. For the contingent plans to the sudden public health incidents, actually we have a different level, including national plan, department plan, and local plan. And this slide shows just the contents of the contingent plans. That means in the contingent plans, all the following aspects will be included. The first, we have to establish a headquarters or commander group and make sure the function of the leading group. And secondly, emergency monitoring and early warning. The third, collection, analysis, report, and notification system of emergency information. The fourth, emergency response technology and monitoring agency and their tasks. The fifth, classification of emergencies and the work plan for emergency handling. The sixth, emergency prevention, on-site control, reserve and dispatch of emergency facilities, equipment, and so on and so forth. And the seventh, the construction and training of a professional team for emergency response. So let's take a quick look at the the contingent plan. And then let's go directly to the laws. So just as I said before, in China, the public health emergency, how to control it, what is the system we established? 1+3. 1 refers to the contingent plan, and 3 means the laws, institutions, and the mechanism. So far in China, we have about 35 laws, 37 administrative regulations, 55 departmental rules, and 111 documents. For example, law on emergency responsiveness, law on prevention and control of infectious disease, law on prevention and control of occupational disease, and so on. Let's go for the institution system. According to the 4 degrees of public health emergency, that is general accident, serious accident, major accident, and special major accident. So the government established 4-level agency, including national, provincial, municipal, and county. So there are 4 different levels, institutions. And among them, the health department are in charge of the medication, prevention and control, and so on. And the other department will participate in and cooperate with the health department. So the health department will establish different systems, such as medical treatment system, that refers to the hospital, something like that, and health supervision system, CDC system, and health emergency professional team, and expert advisory committee. For mechanism, actually, we have both intra and inter mechanism. Intra means within the health department, how to deal with the public health emergency. The health department will establish a special office and establish different systems such as medical experts and hospital, and prevent and control group such as CDC and so on, and experts advisory committee, and so on and so forth. For inter, that means the health department have to coordinate with any other department to show the high efficiency in the dealing with public health emergency. Then let's go to the part 4, COVID-19 experience and enlightenment. So I'd like to share with you this famous saying read by the Garcia Marcus. What matters in life is not what happens to you, but what you remember and how you remember it. From the COVID-19 pandemic, what you remember and how you remember it, it's really a terrible memory. So this slide shows the, the emergency preparedness and responsiveness I have participated in. The right lower pictures was taken in the year of 2004, just 1 year after the occurrence of SARS. we are appointed by the national CDC to provide training for all the CDC staffs of the China. And then we also take our group to participate in some emergency preparedness and responsiveness. So let's go directly to the COVID-19 pandemic. We'd like to compare the COVID-19 pandemic with the worst, the severe Spanish flu pandemic in human being history. So for COVID-19 pandemic, up to date, led to more than 100 million confirmed cases right now, and 13 million deaths all over the world. But in China, it's just led to 100,000 confirmed cases and about 5,000 died. Let's go back to the Spanish flu pandemic. It occurred between the year of 1918 and 1919. So that pandemic led to 1 billion infected. At that moment, all over the world, the population is about 1.7 billion. That means more than half of the population all over the world are confirmed cases. And at that moment, it's about 100 million deaths. So that's the most severe pandemic in human being history. This slide shows, maybe all the people know this guy. This is the ex-president Trump. On the final day of Trump in White House, the US officially told more than 400,000 died from coronavirus and more than 24 million confirmed cases of COVID-19 in America at that moment. So this slide shows the President-elect Joe Biden, who hosts a memorial to honor those who died from coronavirus disease at the Lincoln Memorial in Washington, D.C. So this slide shows the development and the trace of COVID-19 pandemic. We'd like to compare with the COVID-19 pandemic with the SARS, which occurred in the year of 2003. From this slide, we can find that it took Chinese government about 12 weeks from the confirm of the infectious disease and to the government take steps to lay emphasis on this infectious disease and take so many steps to prevent and control it. It took about 12 weeks. But right now, for COVID weeks, it's a very response very quickly. Then let's talk something about Wenzhou. Wenzhou is very special with a huge population. And every day, every night, at the midnight, when we collect all the data from hospital and CDC, we have to calculate and made some, mathematic models to calculate the R0 value. R0 is a key indicators to measure the transmission ability of virus. So from this figure, we can see that on January, 28 or 29, the average R0 value of the whole China is about 4 or 4.5. That means one confirmed cases can infect about 4 persons. But in a certain region of Wenzhou, the R0 value reached its peak. It's about 6.8. That means one confirmed cases can infect about 7 persons. It's very severe. It's terrible. But it just take us a few weeks, we controlled the transmission of COVID-19 in Wenzhou. The second thing we did, we find a cluster incidence in entire shopping mall. By the end of January or the beginning of the February, you know that there is an important festival in China, Spring Festival. At that moment, more and more people will move into the shopping mall, go shopping. And then we find some confirmed cases. Which one is 01 cases? What's the regulation? How the COVID-19, the coronavirus transmitted? We have to figure it out and screen the close contact one by one. And then it takes us about 10 days to control all the confirmed cases and the close contact persons. The third example, in Wenzhou, altogether we have 504 confirmed cases. We compared, actually, there are half of them are from Wuhan, Hubei, and the other half, we can name it as domestic or local patients. We compared what's the difference between the two groups, the two pairs, to figure out the transmission of virus, to find if there is a variety or mutation of the virus. The next task we did, we traced the original, the virus, where it is from. In the world, some Western countries called Chinese virus. It's not good. It's not true. So we just find the select patients from the fever outpatients clinics and screen the CT imaging and to find some suspect and follow up. Go back to search what's the trace to find if it comes from different countries or just from local regions. But right now we know that the authorities, media have just proved the virus has long existed in Western countries. For example, Italy, France, America, and so on. Then we also established a model, a digital model from which we can find the special distribution and early warning, provide early warning. So public health emergency, we can't ignore it. It may be happen once in a century, but one can affect maybe a century. From the dealing with COVID-19, we can get some experience. You know, the COVID-19 is the fastest transmission, the widest range of infection, and the greatest difficulty in prevention and control since 1949. It's a test of national governance system and governance ability. It's a test of public health emergency system in China after SARS. It's a test on the ability of control and the treatment of new infectious disease. It's also a test for education, science, and technology. This slide shows what the efforts the Chinese government made. Rapid deployment, wide notice, and urgent actions. We established many mobile cabin hospitals, and all the people from all over the country, they go to Wuhan, Hubei to help them in dealing with the COVID-19. And our scientists developed some rapid detection kit and vaccine development. So our physicians, some of them will go directly to the foreign country to help them to deal with the COVID-19 pandemic. And some just stay at office by remote consultation to help them. So this is the scene after COVID-19 pandemic in a certain Western country. And this is the envelope of New York Times when the more than 200,000 died. And this envelope shows the COVID-19, the coronavirus. So this is the scene of China on our National Day, October 1st. So we never see great again because we are great all along. So in dealing with COVID-19, we got a great achievement and experience. Thinking as one, the whole country united, they are working, thinking as one. They take steps as one. And also saw our first-class treatment, prevention and control capability, and efficient research capability. In addition, our traditional Chinese medicine participate in the treatment and achieve excellent effects. So I'd like to share with you this slide. From the control of COVID-19, we respect left, so left first. And for the whole country, we unite as one. Regardless of one's own safety, so many physicians and nurses go outside to help other countries, or they just move to Wuhan, Hubei to help the local hospital. And we respect science. We share common destiny. Thank you for your attention. That's all for today. Thank you. Any questions, comments? It's really a good question. As you said, Chinese Spring Festival is coming. What can we do to have a safer festival in China? It's a good question. For infectious disease, we have to think how to cut off the transmission of virus, how to protect the suspectable population. So from my point of view, I'd like to suggest that wash hands, wear mask, and reduce the chance to closet crowded place. Actually, just stay at home. That's good. My suggestion. Well, that's another question. Is there a more sensitive warning system to predict the pandemic throughout the world? The answer is no. The answer is no. So right now, it's really tough for us. When we faced with the transmission of infectious disease, we have to use the traditional method, control the infection source, cut off the transmission route, and protect the special population. There is no sensitive warning system right now. Maybe some days we can get some, biomarker. Even for diagnosis, for early diagnosis of COVID-19. Right now, we just have, the rapid detection kits about the nucleic acid and antibody, but it's cannot for early diagnosis, just for the, the assessment of prognosis. If a person who recently arrived home from an area where is undergoing the prevalence of COVID-19, then caught a fever at home, should he go to the nearest fever clinic or hospital or call 120 for help? Yes, you have to go to a hospital. Even right now, if you have a fever, you can't get any prescription of drugs. Just go directly to the hospital or clinic to see the doctor. May I know if there are a lot of people recover from COVID-19 and creating herd immunity? Is it true that the cure of disease will go downward? Well, theoretically, it's right. Actually, it's hard to say, because when you got immunity, we have to detect it. How we have to, what about the concentration in your serum and how it will last? And if it has, have some sequence overlap, together with the original virus, or how to deal with the variant virus or mutant of virus. It's difficult to say. What can we medical students to deal with further challenges such as the pandemic caused by novel coronavirus? Well, for medical students, actually it's a good question. Public health normally is tended to be ignored by medical students. They always take it as a public health as a, belongs to preventive medicine, public health. They don't care public health. As I suggested, actually in our university, we just want to improve our course right now. We want to add additional courses into the training program of medical students so that we can get much more knowledge about infectious disease and how to deal with it, and some knowledge about the public health emergency, how to deal with it. Okay, thank you. Thank you for all the questions or comments. Thank you.
Professor Liu, there's one last question. It say that nowadays COVID-19 vaccines are distributed across the world. So we consider to have safe environment.
Environment?
Yeah, because it say nowadays COVID-19 vaccine are distributed across the world. So is it means that we consider to have a safe environment?
Well, we can say that. Even most of the people take vaccine around the world. It all depends on, just I said, the concentration and the lasting time. So right now, most of the vaccine about COVID-19, we have to take it twice. And it's right now the current vaccine just aiming at the original coronavirus. As we have all known that there are some mutant original from the UK. So right now we have got any clinical data. How about the current vaccine? What's the effect of the current commercial vaccine on the new mutant of virus? It takes time. We have to collect the clinical data.
So I think there's no more questions from the students. So I will end this session. Okay, so thank you very much for Professor Liu for the exciting sharing sessions today. So I believe our students have learned a lot from you. So thank you very much. And we also like to thank the student who joined this session. So now, before we end the session, dear all students, please kindly turn on the camera for the group photo session. Okay, so I see a lot of students open the camera. Okay, so student, please give me a thumbs up. Okay, so ready in 3, 2, 1. Okay, give me a minute. Okay, now I'm going to page 2. So once again, give me a thumbs up. Okay, ready in 3, 2, 1. Okay. Okay, now going to page 3. Okay, ready in 3, 2, 1. Okay. Okay, done. Okay, so thank you very much to all the students who participate in these sessions once again, and also thank you Professor Liu Xiaotong for the exciting sharing sessions today. Okay, so before we end the session, please kindly remind that tomorrow the session will start at 9 a.m. sharp. Okay, so please be punctual and please log into the Zoom 30 minutes before. Okay, so thank you very much and see you all tomorrow.